and greetings to both Professor Dr. Shakuntala Chhabra Madam and Dr. Sunita Tandulwadkar Madam. I extend a very warm and a very heartfelt welcome to all the viewers of this podcast. This is the star Gyan Pravah initiated by our Fogsi leader, President Dr. Sunita Tandulwadkar Madam. ज्ञान का बहता अनोखा एक रंग रोज रोज एक रंग हर रात 8 बजे जुड़िए आप फॉक्सी के संग. And on 18th of each month, we will be having a deep conversation, charcha and discussion. We will be rubaru with someone who is a legendary, iconic figure who has worked immensely in the area of maternal health and has significantly helped us in reducing our maternal mortality rate. Today we have with us one such legendary person, Professor Emeritus, Professor Dr. Shakuntala Chhabra Madam. Madam, we welcome you on this platform. This Star Gyan Pravah is initiated by our Fogsi President, Dr. Sunita Tandulwadkar Madam. She is a powerhouse of immense work, discipline, and dedication. She is the president of Fogsi and president-elect of ISARA. To her credit are many projects. Some noteworthy projects are like Fogsi Sampurna project. This is a project of 280 CMEs. Thereby, we are trying to reach to each and every OBGY society of this nation. Another project like Fogsi Anubandha project, in which Madam herself talks with, have a discussion and listens to the problems and concerns of the presidents and the secretaries of various societies, thereby helping them in the administrative work. And there is one such beautiful project which combines spirituality and service, and that is Yog Yatra. And not only that, this year also has been mainly focusing on research. So there are many studies going on. Researches are going on, like hypertensive disorders of pregnancy, anemia in pregnancy, AUB in adolescents, AUB in menopause, know your numbers, cervical cancer elimination program. These are very few to name. And also there are many publications to her credit.
Rashmi, that's enough for me.
And this is already a mammoth work done by you. And friends, I must tell you, this is just the beginning. How they say, अगर ये आगाज है तो अंजाम क्या होगा? And she leads by example. She holds the hands of juniors like me with great conviction and compassion. And then naiya to par hogi. So it's a great honor to work under you, Madam. On this occasion, we'd like to hear from you.
Thank you. Thank you, Rashmi, for your kind and generous words. Yes, Foxy is doing a huge work, and I'm happy you gave my introduction with the work of Foxy, because at present that matters to us. Our social project, Know Your Number, Sampurna, that is Swastha Janma Abhiyan, where we believe that every pregnancy should be pre-planned. It cannot be just the accident. Every lady should know the certain parameters like hemoglobin, blood pressure, sugars, thyroid. They should be normal. She should not be undernourished or she should not be obese. That will help us to optimize our maternal and neonatal outcome. Friends, those who are viewers, we want to connect with each and every one of you. And that's the reason why these various projects. The chairpersons are doing dedicated work every day evening 8 p.m. One person on the same. So if Rashmi is on 18th, every month on 18th, you will have a Rashmi with one of the faculty, academic, non-academic, philosopher, social worker. And in 45 minutes, we'll have a lot to learn. Believe me, friends, with so many Gyan Pravah series, I have evolved myself with the immense work the fraternity in our country or outside they are doing. There is always learning. Every day we are evolving, we are learning. Friends, how do I get your work with my work or Foxy's work connected? And that is the 7 publications. That is what Rashmi was talking about. And these are very simple studies of prevalences. Prevalence of anemia in India, prevalence of obesity in adolescent, acceptance of contraceptions, and so on. My humble request to all of you is to go on a Fogsi website, click the presidential activities, and n number of activities are written there. Please join and be a part of a Fogsi. Fogsi president has no value if the Foxians are not with her. You gave me this position, you gave me this chair, you gave me the smile on this face. So I need you to be connected with me and Fogsi. So be there for all presidential programs whenever and wherever we do. Thank you. Today we have Chabra Madam. Thank you so much. It's an honor to be on a Fogsi platform, ma'am. And I'm sure you and Rashmi having the dialogue, we all will be enjoying it from another viewer's link. Thank you so much, ma'am. Thank you for being here and giving your time to Rashmi.
Thank you so much.
Thank you so much for having me.
Thank you.
So it's a great honor for me to introduce Professor Emeritus Dr. Shakuntala Chabra, Madam. So let me tell you a story. Madam was born in a business family at district Gondia. It is a district in Maharashtra. Because she had academic inclination, she got enrolled to Government Medical College, Nagpur, on her merit basis in 1966. In 1973, she passed DGO and MD in 1975. Believe me, it was a kind of unrest and uncertainties. It was such a time of emergency declared all over our nation. During such time of turbulence, Madam joined Mahatma Gandhi Institute of Medical Sciences, Sevagram. It was very difficult in that era for a woman obstetrician to lead a department. But Madam stayed put. Let me also add that when Madam passed FBBS, Madam wanted to be a physician. Her second choice was ophthalmologist, but during her internship, she developed a very keen interest towards maternal health, and she decided to join OBGYN fraternity. The rest is really a history. Nearly almost 50 years, 5 decades, she has served maternal health in the area of Sevagram as not only as head of the department of institute, but also as a dean. She has a very phenomenal and a very pivotal role in establishing Dr. Sushila Nair Hospital, which is a self-sufficient center of maternal health in tribal Melghat area at Uttavali. We will be discussing more about it in our conversation. To her credit is also a very noteworthy Akanksha project. We will be also discussing about it. Madam has always been a very strict teacher. She not only expected best, but she expected something even more than best from her students. Her students, now they themselves are HODs and professors. They are spread all over the globe and are serving maternal health. Madam has been phenomenal in decreasing the maternal mortality rate of the area. To her credit are many awards and uploads. Let me formally tell you that Madam has been WHO's consultant at Indonesia, Geneva, Bangkok, Pattaya, Thailand. She has been chairperson of Scientific Advisory Committee of ICMR Mumbai. To her credit are many special awards. To mention few, Lifetime Achievement Award by Association of Gynecology Oncologists of India, FIGO's Distinguished Community Award, Services Award for Emergency Obstetric Care. She got it received at Malaysia. Best Teacher Award, MUHS Maharashtra. Unsung Heroes Award by Fox's Justice Association at Nagpur. Dr. B.N. Purandare Outstanding Service Award by MOGS. It was a Lifetime Achievement Award for her exceptional contribution in the field of maternal health. and also Lifetime Achievement Award for exceptional contribution in reducing maternal mortality. To her credit are more than 700 research papers and many case studies. She's a teacher of teachers, and her experience in clinical teaching research is of more than 50 years. And it's a great honor, madam, to have you today on board with us. Welcome, ma'am. At present, madam is working at Shirpur. Shirpur is in district Dhule, and she is working at Tapan Bhai Mukesh Bhai Memorial, Patel Memorial. It is a medical college and research institute run by Shri Vile Parle, Kelbani Mandal, Mumbai. And madam is establishing the maternal-fetal unit here, and this is aimed at serving the rural population or the tribal population of the Dhule Nandurbar district. And it's a great honor, madam, to have you with us. Welcome, madam.
Thank you, Shakuntala ji. And I'll join from the viewers link. It's lovely to hear about you. And I'm again grateful that you joined Fogsi platform. Thank you.
Thank you, madam. Welcome, madam. Madam, you have always been known as a teacher of teachers. The majority of us, you know, as a very hardcore teacher. So from an era where even the textbook were scarce, there was scarcity of textbook reading material, to the era of abundance of availability of material to be read on internet. From an era where a teacher was so insistent that even the percussion and the auscultation of the student should be perfect, to the era of simulation techniques and skill labs today, to an era where a resident has to run corridors to the old dial telephone to inform her boss that there is ruptured uterus, to the era of instant broadcasting messages of call of help. You have seen a lot of changes in medical education. Madam, how do you find this change in medical education today?
Thank you so much. Before I answer the question, I would like to say my heartfelt thanks to Fogsi, especially Dr. Sunita ji, Rashmi, to you, and all the chairpersons and every member of Fogsi. I don't know whether I deserve this honor which you have bestowed upon me, but I'm really grateful and I really appreciate. Thank you very much to all of you. About medical education today also, I believe in this era of PET and MRI and CT, everything will. Nothing can replace head, heart and hands. Thorough clinical history, thorough clinical examination, irrespective of the specialty, is a must, which in no era should go. 2 days back, I read the man who was working now on AI has left his place because he himself is saying that we are going towards a wrong direction. I fully agree with him. I will not use the words wrong direction. Development must go, research must go. We must develop technology, and technology should not replace, I'm repeating, nothing should replace head, heart and hands. And that's what I used to say. I will continue to say till I go to graveyard. As far as technique and doing clinical practice is concerned, in jokes, in Sevagram, sonography department, young persons used to ask my residents, madam se पूछो क्या लिखा है, हम वो लिख देते क्योंकि वो हमारा गलत कर देंगे. So imagine that was the honor given by the sonologist in Sevagram. I always used to, when we didn't have models, used to use dressing pads and gauze in theatre, operation theatre, sitting on the bench when somebody is operating. That this is how it is. When you put your finger, this is what you will feel. See, she's operating. That's how, and it continues. Thank you.
Thank you so much, madam. You have perfectly mentioned it. And madam, there was also certain very high maternal mortality rate when we joined in this area. And you will always be known for the drastic reduction, the measures you took, the policies you implemented to reduce the maternal mortality rate. You adopted some villages. We would like to know about it in more depth because that is an area of concern for all of us.
I must accept that it was really very high. If I remember the figure, it was 1220 MMR in 76. Now, when 2024, it was, I think, nearly somewhere around 50 or so. The way we always accepted our faults also. Once the Deputy Commissioner of Maternal Health gave me a compliment. You are the first HODs who has accepted that there are problems at referral also. We always used to blame that community se late aaye hain, and isliye we couldn't say. So blame game doesn't help. That's we learned in the beginning. We adopted villages and we ensured that everything. We used to have role plays in the department. That is, if a woman comes from casualty, she comes, where are the problems? From in our referral system. It's from entry to casualty to our place. And the time doesn't permit, I have stories to tell you when dead bodies used to be brought. A murder was brought and my resident was being put to trouble and I came from OT. So this was happening. So we used to do this, not only discussions, role play, that BP apparatus is not working, laryngoscope is not working, small things, like everything is important. Material, infrastructure, material, manpower, knowledge, skill, and attitude. I used to say fight with Yamraj. That was one aspect we looked at. The other aspect was that we adopted some villages to start with. It was actually, I joined Dr. Ullas Jaju, who was working for immunization of children. And those days we never had money. So we used to buy and give it to people, measles vaccine. And I joined him. And later we did community-based cervical cancer screening also. So we tried to ensure that every woman, we used to see what is happening, encourage everyone to come to the hospital well in time. And from 19, it was 58 villages. We didn't actually, many other responsibilities were given to me, so I couldn't expand it further. But there was a ripple effect. When you're working in 2 villages, the other persons, they collect water, they wash clothes, they wash near the river. So they spread this message. I remember those villages, 9 female children, and they were never expecting sterilization. And we have a record of 1 female child in sterilization. एक ही line कहा करते थे, मैडम कह रही है तो सुन लो. So I used to feel so happy about it. And I always used to feel that they come from villages. We tell them to come. We have to ensure that they get quality of care. Sometimes they used to say कि madam को ही दिखाने, and my residents used to object them. To some persons, I used to give them slips also. ठीक है, कोई मना करेगा तो ये कागज दिखाना. Madam ने कहा. So we tried to keep them satisfied because that satisfaction helps to spread the message. So I can say from the village hut to the medical college ICU, that was how we worked, number one. And we were probably the first ones I presented in Lucknow that obstetric ICU should be separate, because when you refer a patient to other department, that attachment is not there. So actually I fought with my own management also that we should have a critical care. It was 2-bedded only to start with. Now there is a bigger one, but I fought with the management also to have critical care in obstetric department so that that attachment continues and the patient survives. Thank you.
Yes, ma'am, absolutely. So while implementing this, madam, did you have cooperation from all the surrounding area or the villages? How was the mentality of the people around at that time?
Most of the times they were very cooperative. Once I remember, there was a village where many people used to take alcohol and they troubled our nurses, and the serpent intervened actually. That person was, I will never forget that person was asked that we will not allow you to stay in this village. So they took action. So I will say it was complete cooperation from the villagers which helped. So there were problems in the beginning. Like when nurses used to go, especially when we started working in slums, there was big problem. We worked in Wardha slums also. There the problems were mainly blame villagers, but problems were more in slums than the villages. Yes, there were problems, but we could sort it. Thank you.
So, madam, social obstetrics is a very big problem, very big area to be an obstetrician has to deal with. And not only in those era, but also today, this is a prevalent problem of unwed mothers. You have faced this problem on a larger scale, and you have done a lot for these unwed mothers. The project is done by name Akanksha. Madam, would you like to tell us something about Akanksha project?
Thank you for asking this question. The whole thing is so dear to my heart that I can speak for us. But the time won't permit. It was way back in 89, 80. Actually, the story goes much behind how I got interested, etc., etc. But 89, when we started the project, everybody in Kasturba Health Society said, no, we cannot have such a project of helping unwed girls with advanced pregnancy. The director of the institution, Dr. Sushila Narale, we used to call her Badi Behenji, she said, I'm with you, convince others. That line was enough for me, and we went ahead. That was way back in 89. There's a long story, I won't go. And those days we were helping the girl, but nothing about surrender, adoption. 2001, it came to either I stop the whole thing or we run the center also. I had 3 sleepless nights because the department was very, very busy. Then I went to, by that time she was no more in this world, I went to the President Shri Dhirubhai Mehta. He said, do you want to do it? I said, yes, sir. I have 3 nights. I have not slept for this side, that side, but I don't want to stop. He said, tomorrow you get a half-page written. And when I went there, my really close colleagues and everyone, well-wisher, everybody said, one person actually said, Kaha Okhli mein sar dal rahe ho? I said, I have taken a decision. I'm not going backwards. So that was 2001, and the document was signed by none other than late Shri Manmohan Singh Ji also, who was our trustee. And then there was no looking back. 2001. There have been, between 89 to 2001, there were many problems. Anybody who is interested, I can share. From 2001 to 2004, there were real struggles for getting license, and we don't give a single penny to anyone. So, you know the system, but then we got license for keeping the baby, and for then 2002 for keeping the baby, 2004 for adoption, and 2015 we have international adoption now. I was worried, but my colleagues are taking care, so I'm very happy it's going on. So it's something where we have been able to support, I think, around 700 girls and nearly 300 direct adoptions around the world, I can say. When I left, there were 2 babies who were going. One was to go to Italy, and the other was for America. I'm not sure. They have still not been adopted. Some procedure is going on, but they'll go. So we have babies around the country, around the world, and I always feel very, very happy about it. Thank you.
This is a very great step into the cause of humanity, I must say, ma'am. And when you were working in this area, madam, then you also have worked into the tribal Melghat area of Amravati district. These are very different type of 2 geographical locations. So you must have faced a different set of problems while setting the unit at Melghat area, that is in Utavli. Would you like to enlighten us something about it? How would you face the geographical differences and also the mentality of the tribal community?
When I left Dean's chair, I was asked 3 things. One, increasing the seats from 65 to 100. Other was development of our cancer department, make it TCC. And third was this Melghat. So that we will have a center, and I was asked to make a project. I made a project, and we sent it to Government of Maharashtra and Government of India. Government of Maharashtra, unfortunately, did not respond. Government of India responded and said it should come from Government of Maharashtra. And then we connected to them, and then we were told that why don't you take the Dharni hospital? And we met the Public Health Secretary, and everything was done. MOU was ready. It was going to be signed. But then because we were an NGO, there was some political problem, and it was a full stop to all the work done for nearly 10 months. So I was very disappointed, but both the persons, Mr. Halbe and Shri Dhirubhai Mehta, they said, don't get discouraged, we will find a way. And then Bharati Brej Samaj, they offered 5 crore rupees to us. And then we moved ahead. Now, getting money was one side and to do the work was other side. There are many, again, there is a long story. I won't go into the details. Yes, the problems continued about the staff, the doctors working there. I used to go after every 10 days for 3 nights. I have done cancer surgery also there. Caesar's residents used to be posted like in rotation 6 weeks. But I must accept that having the team was difficult and continued till I left. And I do not know whether indoor services are still going on or not. But yes, to retain persons, actually I presented this in an international platform also. We did a workshop. There were 2 other persons from New Zealand and 1 from Canada. Retention of people in rural areas, how difficult it is. So it is difficult. I really feel that I strongly believe that it must continue because the women there need us.
Yes, ma'am.
Really need us. So there have been very many difficulties. मैं कभी कहती थी मैं सबकी आँख की किरकिरी बन गई हूँ. But then I never bothered. And there's a long story behind it, which again I cannot share. That one day when I was really, sometimes there used to be difficulty. I said, "Ye karna." Something happened, and then I took a firm decision. Whatever happens, I will not quit. And I didn't quit. My last visit was on 28th of March, 2024. I left Sevagram on 31st March, so 2024. So that again is still dear to my heart. And anybody wants to know, I can share. Thank you so much.
So many patients you have treated. So many patient stories you know by heart. Any patient story, madam, which imbibe on your heart, it changed some of your decisions, it impacted you? Would like to know from any patient story.
Again, there are so many, I won't say, but I'll share something in a minute, that sometimes how patients and their relatives help you do the best. We had a woman, she came with inversion, almost pulseless. My door was getting locked and I was in front of the door, and the stretcher with the gynecologist. They walked in, the stretcher and the gynecologist and the relatives. She was almost pulseless, then little resuscitation, and it was inversion with hemorrhage. Our operation theater was getting renovated, so it was burns wards where there was a special area. The anesthetist said, "Madam, 60 I said 0 से 80 पे लाया था, अभी 60 है." So he said, "Just बता रहा हूँ." So God helped us. We could do everything and we could save her. And after 18 months, she came with pregnancy. I thought she will develop Sheehan syndrome. Nothing. She came with pregnancy. And when this woman came with pregnancy with hyperemesis, another woman came. She came from Andhra, multiple fibroids with pregnancy, bleeding heavily. And you know, this man, I still remember her name. Ethical purposes I won't take. Her husband told those people who came from Andhra, "Madam जो कह रही है सुनते जाओ, सब ठीक हो जाएगा." See, this is how I said, patients are walkie-talkie. Send a satisfied patient. And she was also maternal, severe illness, MNM, and this also is MNM. And we didn't have to tell the relatives. Residents were telling that we gave her 18 bottles this blood. The other lady inversion received 7, and this lady actually, there is a long story about this woman. Total 18 transfusions were given to her and she survived. So patients, relatives, satisfied patient, when they see the team working, fighting with Yamraj, they help you save the lives of men. So that attitude, I repeat, knowledge, skill, and attitude is very, very important. Thank you.
Thank you so much, madam. And madam, at present, you are working at Shirpur in Dhule district. And incidentally, this is the hometown of late actress Sunita
Yes.
And we know she died during childbirth due to the complication postpartum. And how is the work, what you have decided for this institute, madam? And
at the age I am, I was, when I took a decision that I'm leaving Sevagram, it's Mr. Bhatia, who was Chief Secretary of Maharashtra. He knew me since years. He used to call me and telling that they want good persons here. And when I took a decision, I said, sir, I have my appointment up to 31st. I have been given extension, but for some reason, I don't want to continue. And is there a place for me? He said, you come from 1st April. I said, 31st March is my last day. I said, 1st April se to nahi aungi, but I'll go home almost 5 decades. And what he wanted was that we develop a department of Obs and Gynae and Pediatrics also, the Center of Excellence. And when I came, everybody has been very cooperative. I first did mapping, met the collector helped me meet the DHO, civil surgeon. I've been to PSCs, what are the problems. Things which are visible are not really true, that also I learned. When I came, I was told certain things. So I thought something like Akanksha is not needed here. But then I went inside, the things were different than what I was thinking. So presently, hospital is yet to be started. Medical college will take 3 years after the hospital started. So I don't know how long I will be here, but whatever documents I have made and given, I'm talking about having one of the best departments of OBGYN with community linkage, which we did in Sevagram. Sevagram, we did it after years. Here I'm suggesting from the beginning only. In Sevagram, we had done family life education for adolescents. This Unwed Girls project led to that actually. And community-based reproductive healthcare project, which I have suggested that it should be from the beginning. And then another is Well Women Corner, where the woman comes, her mother, mother-in-law, daughter, they want to ask their queries. Sometimes they're shy, they don't come. So they will be able to ask about their queries. So wellness, Well Women Corner. Certain things I'm suggesting, hopefully, as it starts and that young persons come, and it will be, the plans are really, really very good. It's going to be more than 1,200 bedded hospital where plans for robotic surgery, heart surgery, and of course, everywhere. They want to do research in tribal health, especially. I was asked to make a document for research center, and in that process, I talked to the teams from Kashmir to Kochi. My colleagues and my students have become professor. The girl told me when I called her, Madam, मैं Kashmir में professor बन गई हूँ. I was so happy. So as I was trying to connect, so that's how things are. I think it will be an excellent hospital in a tribal area where travel is difficult because it is not properly connected to railway, air. Bus is okay. I have not traveled, but I was told that bus is okay, but it is difficult. Transport is difficult. So it will be really good for the tribal population, not only of Maharashtra, but adjoining Madhya Pradesh and Gujarat also. Thank you.
We wish you best, madam. And sometime we would also like to visit your place at Shibpur. And we know that you will be of immense help to this area and patients, mothers and units of this area, madam. So one last question I would like to know from you, madam. Mainly you have worked in rural obstetrics, social obstetrics, but majority on main scale, you are known as a teacher of teachers. And I would like to know, madam, what you would like to advise to the young generation of OBGYN students, especially.
It's bilateral. The teaching place, learning place, I should say, and the students, trainees. The teachers should try to be role, maybe they are not role models, but they should work in a way that there's a ripple effect for the students. Number one. And again, do not make your students too much technology dependent. And any medical institution should be teaching training should be need-based and students-oriented. I'm interested in a particular subject, I devote a lot of time on that. No, I should know what is the need of the student. What a final MBBS student should know, what an intern should know, what a MD student should know. So it is need-based teaching, training, learning. and actually I should say facilitate the students to learn. I have all my life, I have said I learn from my, if somebody is walking on the road, I try to learn from that. My co-travelers, a watchman, a helper, a nurse, my students, my colleagues. I always say that we learn from everyone, small things. The students should also be encouraged to have a very open mind. No copying. That I, in the department also, when a new lecturer used to join, I used to ask her, "Aapke wahan kya acha hai wo batao, we will add to it." So it is, what should I say, students should be always, again I'm repeating the same thing, head, heart and hands. No technology will replace, and students should be encouraged. Thorough clinical history, obstetrics. Sometimes, some women do not tell, or sometimes they purposely hide also certain things. So you should have that habit or that feeling that she is with you and she tells you. So that they come out with proper history, and of course, never forget that you have a thorough clinical examination, and have safe practice but not defensive practice. Safe but not defensive, because too much of that affects the whole chain actually. The way you interact, the way she goes, and IT is available. They go and check whether it was necessary or not. Thank you.
Thank you so much, madam. It's not possible in a time limit of 40 minutes, 45 minutes to completely have this discussion with you. But I must say it was a very great privilege and very proud privilege for all of us to have you on board today. I'm very much thankful to you for your time, and it was a great honor to have discussion with you, madam.
It was really, I again repeat that I'm really grateful to you, to Dr. Sunita and everybody, the whole team. And it's not, one life is not enough to do what you want to do. And it's not one person, it's always a team. And one has to, I always say, you agree to disagree and be together. That habit should be there. And this is what we tried everywhere, that we can work together. We differ. No two human beings can think similar. No human beings. So we have to become teams for the best of the health of women. Everyone online, I should say, I use the word global health. So we share information from each other, and we try to help women and try to have the best of teaching training in the best of atmosphere. Again, it is knowledge, skill and attitude. And we teach our students some about compassion and empathy also. Yes. Because my father used to say, "Neek insan bano." I always tell my students, try to become a good human being, and to become a good doctor will be easy. Thank you.
So, as being very correctly said, Guru bin Gyan kahan se pao. It was a great thing to host you today, madam. A teacher of teacher, friends. It was a great privilege to have this discussion. I'm so much thankful to you, madam, for being with us today. Thanks
so much to all of you for having me. And I always try to tell myself, I shouldn't become a burden on this earth. So God keep me on this earth only till the time I'm physically, mentally fit to do something for my fellow human beings. Thank you.
My humble regards and pranam to you.
Thank you.